Hi, this is JINYUAN Ren. I'm going to present my research proposal supervised by Zara Isis, which is about exploring key leadership skills for therapists who are treating their patients with autism spectrum disorder, referred as ASD. So in my presentation, I'm going to introduce my topic, define my research questions and hypothesis, then present my research design and timeline. The key concepts of the research is firstly the leadership. It's about influence and the effectiveness of the influence. It is an instrument of goal achievement and its form of persuasion. It is argued to be part of any role such as teacher and therapist. I like to focus on psychotherapists because leadership is part of their work for having effective communication and interventions to achieve treatment goals for patients. However, leadership training is lacking in their formal education. I actually focus on therapists who are dealing with ASD patients because ASD is a group of pervasive developmental disorder with impairment in social interaction, verbal and nonverbal communication, as well as the presence of restricted and repetitive patterns of behavior. It is important to study this because of the high prevalence. There is 1 in 50 children in US are diagnosed with ASD, and is a lifelong challenge for individuals and families. We like to focus on transformational leadership style because it is the most popular leadership framework and is argued to be universal for different leadership settings. It is unknown in the current literature that how transformational leadership style influence ASD treatment outcome. According to the framework proposed by Bass, there are 4 dimensions in the transformational leadership style. The first one is inspirational motivation, which is defined as affect-laden communication. In the context of ASD children, as they experience sensory overload quite easily, effective communication approach could interfere with their emotional stability. The second one is intellectual stimulation, which is about challenging traditions and encouraging creativity that often involves abstract ideas and flexible structure, which is often evident to be too difficult for ASD children to understand. The third dimension is idealized influence, which is the vision to enhance goal clarity and task focus by providing structure and guidance. This could help ASD children to comprehend the expectation and purpose of the task to get better results. Individualized consideration is the emphasis on a unique and tailored support for followers. This is especially useful for ASD children since their experience of disorder is diverse across the spectrum. Each person's situation should be attended individually. So to answer the research question, how transformational leadership style informs ASD therapy, based on the literature review, it is hypothesized that ASD therapists would possess less behavior in inspirational motivation and intellectual stimulations for better treatment outcome, whereas they could possess more behaviors in idealized influence and individualized consideration for better ASD treatment outcome. The research will be firstly submitted for ethics approval to Monash University. Once it's approved, we will recruit target participants as therapists who have expertise in working with ASD patients from ASD rehab centers. Snowball sampling will be applied. Demographic information and leadership style will be obtained from participants anonymously after the consent. Leadership style will be measured by multi-factor leadership questionnaire, which is the most authoritative measure. Quantitative measure analysis will be applied for examining the results. Techniques such as correlation tests and t-tests would be applied. The corresponding timeline is divided in 3 stages. Firstly, during this teaching period, I will finish defining my research questions and plan. I will finish the literature review, which is also the introduction section of my thesis, then submit the ethics application to Monash University. Then for the next teaching period with ethics approval, I will conduct the research, collect the data using a questionnaire, analyze data, and write measure and result section of the thesis. Then the discussion will be written as the final part of the thesis. The complete thesis is part of a GDPA course. The current research is worth studying as it could contribute to the current literature because it bridges two research fields together and examines the ASD treatment delivery from leadership theory approach, which is innovative for the literature. It could inform the way to improve effectiveness of intervention, which contribute to a life quality of ASD patients. It emphasizes the significance of leadership skills and knowledge for psychologists to inform their formal education. And this is the reference for my research proposal. Thanks for your listening.